we've talked about sleep disorders, and so what kind of self-healing can folks do? And well, we already said. Well, I guess you'll know that you're not getting enough sleep if any one or a number of these variety of symptoms occur.
Yeah, and also then sometimes people need help because they're so stuck in a pattern, and that's where the work that I do as far as the treatment comes in, is we identify how the nervous system is stuck in that fight or flight pattern and actually physically deprogram or reset that nervous system. And you know, most of the viewers are probably more familiar with chiropractic as evaluating the alignment of the bones of the spine.
Sure.
And certainly that's important, but that's an end, not an absolute end result, but it is an effect of imbalance in the nervous system. What most people don't understand is that the primary importance in chiropractic is the neurological component, because that's your brain and your central nervous system, your peripheral nerves, and it runs everything. And if there's interference in that nervous system, it can't function as you were designed, because there has to be that proper communication from the brain to the cells, from the cells to the brain, so that everything works in harmony. So someone can be doing everything they possibly can do and still have a problem. That's when they need some help, and they could choose acupuncture, they could choose traditional chiropractic work that I do with the bioenergetic synchronization technique, a variety of things. Also, there are some nutritional supplements and herbs that can help. Magnesium is a very, very important nutrient as far as relaxation. It induces muscle relaxation. There's some very good products in the market that will help that you can take at night, because magnesium will help, again, relax you. It's used up a great deal in the stress response, and tends to be pretty deficient in most modern diets.
Now, Matt, I'm trying to remember now my nutrition class. Do you need to take calcium with magnesium, or do you need to take magnesium with calcium or something? Aren't those a combination?
Well, they are, and again, in nature, everything is in the proper ratios. And as far as supplementation, basically, most supplements are twice as much calcium into magnesium, and really it should be just the opposite, because you need the magnesium to absorb the calcium. If you don't have the magnesium, the calcium isn't utilized properly. Other things that are important are vitamin D, because if you're not getting enough vitamin D, either from sunshine or supplementation, you can't utilize the calcium. And the calcium is, again, very important for the ability to relax and for the muscles to actually fire. The magnesium for relaxation, the calcium for activity, and then also another big factor is vitamin K, which you get from your green leafy vegetables and your cruciferous vegetables. And you know, going back to hormones, hormones can be thrown off too. You need melatonin and such for proper sleep as well. That's why when you travel and you get jet lag, it's because you're thrown off with your normal sleep cycles, because again, your daylight and nighttime cycles are off, and the pineal gland, which helps to produce the melatonin, gets thrown off, and you can't rest. So there's a variety of things that are important. Some people can try melatonin if they have sleep problems as well. That's more drug-like, but it's a natural substance.
Are these prescription things?
No,
or
these are over-the-counter. You can get them at any of the local or nutritional stores.
You mentioned a number of different supplements and stuff, and then it sounds to me like you got to kind of be careful about taking supplements. You could easily overload yourself with one thing, thinking that you're helping to alleviate an issue that you have going on. How do you feel about taking individual supplements over taking like a multivitamin or something that sort of has everything in it? And of course, you should do it with your diet and not be taking pills. But how does that work?
Well, it is a challenge when you're taking a lot of individual things. The key is starting with a good diet, a good base of whole food supplements, because even if you're eating a good diet, most of our soils are depleted. And so that's again why it's important, as we've talked before, on eating organic as much as possible. Because if you're not eating organic, you're not, you might be getting pesticides and herbicides, and the nutritional value may be very minimal compared to an organic fruit or vegetable.
They're dealing with, I read a thing in Acres magazine a couple months ago where they were talking about even over-tilling the soil can ruin the nutrients in the soil. And as you mentioned, that pesticide thing, that's horrific. But so a lot of the things that we may think we're eating great vegetables, if we're not eating organically, there may be no nutrient value at all in some of that stuff.
And it's so important, and that's what we see, and again in the standard diets, is we have a country, a nation that is overfed and undernourished. There's plenty of calories, but there's not enough nutrients. The nutrients aren't dense enough in the foods anymore.
And if you eat foods that are processed in any way, it's really a good idea to kind of take a look at the label and see what the process was and how much other weird stuff is in there.
Yeah, and again, you have the artificial sweeteners, which are
high fructose corn syrup, useless crap.
Well, that isn't necessarily artificial, but it's certainly more like white sugar, and it's insidious. We're seeing a country that's just overweight and obese, and again, that tells us two things: not eating properly and not getting enough exercise. And exercise, again, looking at the 6 essentials, is so important as far as sleep, because if you're not using your body, there's nothing, your brain isn't telling your body, hey, you got to sleep, you got to rest, you got to repair, because you didn't use your body. So the biggest stresses in modern living are not using our bodies. 100 years ago, when chiropractic was first invented, so to speak, or discovered, the primary stresses were physical. And so that's why traditional chiropractic care really solved so many problems, because the spine was wrenched out because he did something. Mm-hmm. Nowadays, the biggest stresses are mental, emotional, and chemical. So that's where things have had to shift.
Now, if people with a busy lifestyle, so I see a lot of folks that buzz into the gym about 5 and put in an hour or so of intense workout. Isn't it better to do more a kind of aerobic or like even walking or something? You could probably put in as much time without stressing. I don't want to say irritate anybody who's a bodybuilder, but to me it's more you can bulk up, you can do a lot of damage to yourself or misbuild your body by not realizing the process that you're in. So isn't it more important to do an aerobic exercise and keep everything moving than it is to doing specific isolating body muscle things?
Well, again, looking in balance, because if you think about if you were out working in the field or in the garden, you'd be doing both. You'd be lifting things, mm-hmm. and you'd be walking. So basically when I'm looking at fitness, I look at 3 basic factors: aerobics, flexibility, and strength. And you need them all. So if you're doing one or the other without balancing it, you're going to be lacking in some way. Because one of the things that happens as we age is we lose muscle mass, and we're finding that the more you start elderly people on weight training, the better they're able to care for themselves in their normal activities of daily living. So, it's a balance. Again, it's not that weightlifting per se is bad, but if you're doing that and not getting your cardiovascular or not getting your flexibility in, then you're going to have a muscle-bound body.
Hey, what about this 80-year-old guy who's got a picture of, I don't know if you've seen this or not, but in some magazine, he's got the body of about a 40-year-old, but the face of an 80-year-old, And he says he's taken some miracle thing to get that. Yeah. This is something that's happening with a lot of people. I'm surprised at how many of my friends are going, I keep waking up in the middle of the night and I wander around and then I go back and get sleep. How long can you last with this before you start to break down?
Not long. You can, dip into your reserves for a period of time, but you're going to pay the price if you don't replenish at some point.
Well, what happens to, all right, say you're getting, you're having a relatively good diet and you're getting some exercise, but your sleep is still messed up. Does the dietary and exercise thing offset that?
Well, certainly better than if you weren't making good choices in the diet and exercise. Really then you're going to go downhill quickly. But the key is remembering that's why we call it 6 essentials. And that's why you have to, again, look at your choices in all of those 6, and yet always understanding that the thought factor is the most important, because your thoughts and feelings have a more powerful effect on your body function than all the other 5 combined. So if you're going to focus on, if you have to only focus on one area, your thoughts and your feelings would be the most important, always. Because you can be making perfect choices in all the others, but have a huge amount of interference from negative thoughts and feelings.
And, you know, in just paying attention to that, you could save yourself hundreds of dollars in therapy. You know?
Well, absolutely. And, you know, that's why natural living and natural health care is so important, because especially with, we're looking at the economy and we're looking at people having money problems, you can't afford to get sick. One of the number one, I think, cause of bankruptcy in this country is medical. Because if you get sick, it's astronomical. You know, I've told many patients that, you know, 1 year of chiropractic care could cost the same amount as 1 day in the hospital.
Oh, yeah. I don't even get started on that. It's just phenomenal how much that costs.
And, you know, so, you know, as more and more people don't have insurance, and, you know, it's just wild that we have to take responsibility and take an active role, each of us individually, in really stewarding our health.
Sure, and again, your point is really well taken. The mental health, you know, you could be doing everything else right and be messing yourself up with your thought process, or what you allow to get in there. You know, how you're watching too much television or being fed whatever it is. I don't know, powers that be. I don't want to be too much of a conspiracy theorist, but I don't ever see much on television. This is kind of negative. You know, they're always hyping the murders, or the TV shows are nasty, they're insulting. And if that's the kind of stuff that's always going in, then you can't help but.
And so you're going to be a program. And so really important, learning how to take the time before you go to sleep to put on some quiet music, or do some of the 4-step breathing, drink some natural calm, you know, supplement with the magnesium, a cup of herbal tea, something to calm you down and get you in the state, you know, like preparing your evening to go to sleep like you'd prepare a fine meal. You know, making sure you have a nice environment and those type of things. And then you're going to set yourself up to resting fully.
You know, I had my friend Punso is a Tibetan monk, was on a couple of weeks ago, and we were talking about, you know, he said, I said, you know, what's your deal? And he said, well, before I go to bed at night, I review my day, I see what I did that was really good, and I give myself a little pat on the back for that. And then if I see something that I wasn't that happy about, I have the intention that the next day I'll do that better.
And what you can do is practice, go through some forgiveness. What I like to do is practice affirmations as I'm going to sleep, and practice forgiveness, review the day, and forgive or let go of anything that I felt was negative or harmful or hurtful, and go through and say, okay, I learned a lesson, I can do that better tomorrow, like he said. So forgiveness is a big key for healing.